gentlemen, welcome to the second plenary session of the World Hospital Congress. Please welcome our speakers, led by the session chair, CEO of MP Shah Hospital, Dr. Toseef Ding.
Thank you. Hello. Okay, good. Good morning. Bon dia. And jambo to my Kenyan colleagues. And I've often heard the saying that what happens in Vegas stays in Vegas. But I want to remind you there's something that happened in Rio 32 years ago, and it will not and did not stay in Rio. Any idea what happened 32 years ago in Rio? Interestingly, it is in Rio de Janeiro that we hosted the famous Earth Summit and launched Agenda 21. That agenda was a call to action for sustainable development. And here we are today, still fighting the same battle, but now in healthcare. I want to start with a bold analogy. Imagine we are all on the Titanic. We may be on different decks, different hospitals, different regions, but we are all heading towards the same iceberg, climate change. The question, ladies and gentlemen, is, will we steer clear in time? Climate change has a direct and increasingly damaging impact on community health and healthcare delivery. Luckily, the healthcare sector has many opportunities to reduce its negative environmental impact while contributing to better health for all. Today, we are here to debunk some of the persistent myths around achieving net zero in healthcare. These myths hold back progress, but today we are going to dismantle all these myths with data, with case studies, and expert insights from our esteemed speakers. Vital will be taking us through demystifying data. Dr. Zinat and Carrie will be speaking about costs and investments as barriers to going net zero. And of course, Nick Watts will be talking to us about engagement of clinicians as fundamental leaders. Ladies and gentlemen, the session will also encompass a Q&A session. So I request you to download the Congress app. Once logged in, please go to the program, choose Plenary Session 2, and then click on the Q&A button. You can also vote for your favorite questions. Data collection has the potential to indicate where to improve, but can also be perceived as an exhaustive first step. I will now call upon Vital Ribeiro to talk about demystifying the data. Data as an ally and not as a hurdle. Vital Ribeiro is the president of the board of the Brazilian NGO Healthy Hospitals Project, which brings together more than 450 healthcare organizations in Brazil. Vital is an architect, urban planner, and hospital and health systems administrator. He comes with 35 years of experience in environmental management, climate change, and health. Welcome, Vital.
Good morning, everyone. I'm very pleased to be here. I want to thank the International Hospital Federation for this opportunity, Brazilian Hospital Federation, and special thanks for the Geneva Sustainability Center for this work. I will be talking about data, and as Toseef said, it used to be very scary for managers and for health professionals, particularly about sustainability data, or more specifically about climate change. So data is critical, and I think debunking the myths, it's a very good approach because we have this agreement. Everybody is concerned about data, but nobody really know how to do that. So I will start by a little overview about PHS. It's Health Hospitals Project. It's an NGO. And we started working in 2008 by promoting a seminar. It's a very short story. A group of health professionals that became more like environmental manager along the time. And the mission of PHS is to support these people on this agenda. We launched the Global Green and Healthy Hospitals Agenda with 10 items. So the work has an evolution, and very fast we arrived on the climate crisis, which brings a lot of complexity for the professionals at the working in the health system. So our approach is pretty much about supporting these professionals and engaging the community and helping the hospitals and the health facilities to do this, and also being an example for other sectors. We are very proud about having a Brazilian-wide participation. These numbers reflects basically the population and the number of health services in the country, in the regions. So we have also more than 1,800 of individual members, and basically 350 hospitals that are really reporting data on the 4 programs that I will show next. So it's where we are today. These are the 4 programs that we call challenges. We have the climate challenge, it was the first to be launched, the waste challenge, the energy, and the sustainable procurement, which was the newest, but maybe super important as the others. And as you can see, climate is the main umbrella, but the others are critical aspects of climate. So it's a lot of synergy among them. Some hospitals choose to start by wasting because they are more mature on this, others prioritize energy, but our proposal is that everyone do the 4 projects with a lot of support. You can see the material we have to offer to members, and we have technical support, and we have awards and many other workshops and things like that. This is the evolution of the participation. As you can see, the waste is the most popular. And now these challenges, they measure. So data is critical on this process. Everybody says what we don't measure, we don't manage. So our approach is based on data. And as you can see, collecting data at the facility level. So it's very important because we don't have much information about what happens in our organization in terms of environmental impact. Just a short comment, because I know that my matter here is to talk about data, but there is a series of myths that are important to be addressed, and I put some here, but I will get to the data issue. But decarbonization is not for healthcare. No, please. Healthcare is too much important to be out of this process. All the sectors need to be engaged on this. Public health has other priorities. Sure, a lot of priorities, but we need to have a long-term view and how to track the process to reach net zero by 2050. So we need to be conscious that climate change is a huge problem for health, and climate and health is the same. So we are not doing it different than health when we address climate. And healthcare quality, coverage, and access still needs to grow in developing countries, sure, but we can have a shortcut and get there with improving our performance, our efficiency, and this is related to climate. So it's not a different thing again. Doing low carbon healthcare, we are being more social and equity and all these aspects that are critical. Here, we don't have time, I see. I'm cautious about the time, but some aspects of the data that I think it's very important. So many people are with this expectation of having exactly progress on this. And we have a lot of influence of external aspects, internal aspects. So particularly in countries like Brazil, we have a variation of situations that affect your plans. So I'm saying this because it makes more important, even more important, to have a good measure system, a perspective on the evolution, to be committed with targets or to planning interventions. Too much optimism is a problem again. Many hospitals phase out nitrous oxide and have a reduction of 20% of the total emissions of the hospital. And so they expect to have the same in the next year. And no, it's not that easy. So having a better perspective of the opportunities and how to plan the evolution, it's super important. And there are many other aspects that we could discuss on this. And the last one, the team and how to organize the process in the organization. This is super important. And I think the key question here is about form a group. We have, in the first day of the Congress, the pre-Congress, we have a master class, and there was a game Sonia proposed to us from the Geneva Sustainable Center. What you choose, what is the main priority to start to work on sustainability in hospitals? In my group, I choose hiring a sustainability officer, because from my perspective and this experience along the years supporting the hospitals in this trajectory, I think having a team is the most important. And I see some organizations that have more like a network of hospitals. They just hire somebody to stay in the central, in the corporated level. I think it's super important too, but the best solution is to combine a more centralized and another approach by improving the work at the facility level and combine them so we can collect data and identify the opportunities, what is doing right, what is a problem, and this is one aspect that I want to emphasize. Thank you again, and I want to invite you, everybody, for our seminar that will happen in October here in Rio de Janeiro. So see you there. Thank you.
Thank you so much, Vital, and we are delighted to be here in your home country, Brazil. You've been working here for decades to integrate sustainability in the Brazilian healthcare system. What can you tell us about the state of sustainable hospitals in Brazil? And what can our international audience here learn from this today?
Okay, thank you for the question. I think we have really an amazing trajectory from when I start. I have almost 40 years working in healthcare, and I see this as something that sounds very strange for the leadership, and today everybody is talking about and the connection with climate and health. It's much more concrete aspect for the managers and investors and founders. So it's super important. We have a moment, a very special moment in Brazil. We will have COP30 happening in Brazil next year. There is this amazing work of WHO on this topic. We have a global discussion. So I think it's a good moment for Brazil to make this change and to address health equity, social justice, and promoting an example for the world and internal example for other sectors based on this work on healthcare.
Thank you. Thank you so much, Vital. And ladies and gentlemen, this brings us now to our second myth, related to finance and cost as a barrier. I'm sure many of you agree that one of the reasons we don't go green, or we are sometimes fearful of going fully net zero, is because of the cost hurdle. For this myth, we have two speakers, bringing perspectives from East Africa and from the USA. The first speaker, Dr. Zeenat Suleiman Khan, Regional CEO, Aga Khan Health Services East Africa, to provide insights about Aga Khan Health Services and hospitals' journey for climate and related financial figures. Zeenat Khan is the regional CEO overseeing the Aga Khan Health Services East Africa, comprising of 5 hospitals and 50 outreach centers. Zeenat has 30 years of experience in hospital and nursing administration, quality improvement, and patient safety, and has held various leadership positions at the nursing executive level in Asia and Africa. Zeenat, welcome to the stage.
Good morning, everyone. Thank you, Toseef. Every time people introduce me, I learn a bit more about myself. When I was approached by Sonia and her team to participate as the network, Aga Khan Development Network, to talk about this myth, I jumped on it. And I will tell you why. I will take you through my story. 10 years back, AKDN, Aga Khan Development Network, which is my employer, and I have something which I'm not gonna, we all know that, so I'm gonna skip the WHO and why we all need to work on it, but this slide, I will leave it here. AKDN, 10 years back, my employer, with some exciting experts who knew how to collect the data, like my colleague here, came to us, CEO, and telling us, let's get onto this bus. And I'm like, no, I have so much to do. I have to run hospitals. This go green business is all a sexy topic for today. It's going to go away, leave us. We are in Africa. We are in lower middle income countries. We really have challenges, day-to-day challenges. But the vision of our board was consistent. The leadership was there. The strategies were there. And slowly but surely, the CEOs, such as me, started looking at data. And we started looking at the problem as our problem in the hospitals or the healthcare system we work in. This is the climate vulnerability global map. AKDN, where we work in, are these light blue colors. You can see my institution, my organization is really working where it's all red, mostly, a bit of yellow here and there, but we are in the vulnerable communities. And that, again, I want to go back to the first myth of data. We needed to see numbers. Administrators, we want to see numbers. And that's what we did. We started with credible data, credible targets. And one of the first things we did was developing, is it me? No. Developing a tool for measuring in our communities, in our institution. Aga Khan Development Network carbon management tool was the starting point for us. And that was good. We looked at our measurements in all our hospitals. Ladies and gentlemen, our network is in East Africa. We have clinics in literally far, far, far away shambas or villages, and in up north in Pakistan or Afghanistan, we are collecting data at every level to see where do we stand. But that was not good enough. So what do we do about it? How do we work towards it? Which of the aspects of these culprits do we manage? And that took us, and that is the most sexy slide for us. Where do we go from here? Now we have the data. And that is where we got the finance guys together, us together, clinicians together, and looked at the impact. What are the high cost, high impact, and of course, the return on investments? The myth I'm going to talk about today, or I am very strongly putting it to my colleagues sitting around the table in low, middle income countries. There is a way for us to achieve our objective of go green, net zero, but also sustain it operationally, which is what we are trying to do. If you look at this one, the costs which are low and where we really had strong financial returns, the CEOs and CFOs jumped on it. Yes, there are initiatives where we have high cost and high returns, and we had to look around and see how do we get that monies which is high cost. I will give one example here, and if I can move this. Okay, here we go. Dar es Salaam, Mwanza in Tanzania. Mwanza is a city with very low income society. However, when we started looking at building new buildings or renovating our buildings, we have now started at every option, how do we make it climate friendly? Solar panels, water, glazed, double glazing, single glazing. All of these things, while are cost for us, but they are giving us return on investment because our operational cost is reducing. And that is what made the CFOs and the CEOs so much more excited, because our bills are getting lesser and lesser as we go along. And that is what we did in terms of ongoing reduction of our projects. And some of the examples in my system. Some, electrical vehicles, some of us take it for granted in developed countries, but we did not, guys. Kisumu, my CEO is here, Jane. Kisumu town, we got the first EV in our city. And we are so proud of it. And again, the ROI proved it to us that yes, getting that is good for the environment and it is good for our expenses. And remember, I talked about we go far away. We have clinics very far. We have to travel to far distances. So some of these are some examples that yes, we will need funds. Yes, we need to think through it. We need to have first of all, let's collect our data. Let's have mitigation strategies. Let's put it on with our CFOs and see which are the low-hanging fruits. Start with small steps and celebrate successes. Source of funding has been an issue for us in the countries we work in. And ladies and gentlemen, I think we all, at least for me in Africa or up north, Central Asia, there are budgets, internal budgets, our own capital budgets is what we look at. We have limited number of budgets, but now we look at, we need an MRI, we need a CT scan, and yes, we need to change our incinerator to be more net zero friendly. So we are questioning ourselves at our capital equipment budgeting time. Our boards are questioning us, and that is important. Leadership from the governance is important. We have placement and leases. I showed you some of the pictures of solar panels. Some of them are leased. And we work together with those companies, and they're all over in Africa and in Asia as well. And grants. We have partnered with EU, we have partnered with AFDs, the French bank, etc. And we go out and actively look for grants. So yes, it is cost, which is there, but there are return on investment, and yes, the source of funding needs to be looked into. So to conclude, it is our responsibility as the administrators, as the CEOs, as the board and governing body to really work towards this agenda. It is not their problem, it is our problem today. It is good for business, guys. I can assure you that. I have seen that in from small clinics to the big hospitals we have done. Let's engage everyone. It has to be done as a team. The commitment needs to come from everyone, and celebrate successes. Thank you very much.
Thank you. Thank you so much, Zenith. And they say numbers don't lie, and data is the new oil. Thank you for that, Zenith. And that gives a good segue for our next speaker, Carrie Owen Pleats, Regional President, Kaiser Permanente, Northern California, USA, as our second speaker for the same myth on cost and investments. And she'll provide us Kaiser Permanente's perspective. Carrie is president of Kaiser Permanente, Northern California, since November 2020. Kaiser Permanente is area's largest non-profit health plan and provides care for more than 4.6 million people through its 21 hospitals and 264 medical offices in Northern California. Carrie has an extensive career in healthcare administration behind her, including serving in leadership roles and various systems in the USA, including WellStar Health System and Sutter Health prior to joining Kaiser Permanente. Carrie, over to you.
Good morning. Everybody have their coffee this morning? Yes, good job. So thank you very much to the International Hospital Federation. It's actually one of the main reasons why I attend is to obviously share what's going on in the United States, but specifically on climate change. It's actually very much learning from others, especially those that are on the panel today. So at our Kaiser Permanente, our mission is not too dissimilar from many of you across the world. Our mission is to provide high quality, affordable healthcare services and to improve the health, I'll say this again, improve the health of the members in the communities that we serve. Millions of people in America still don't have access to high quality, affordable health care. That's why we're committed to leading the movement, not just to transform healthcare, but to transform health for the communities. And it doesn't just stop with hospital visits. At Kaiser Permanente, we recognize healthy communities require a healthy environment, the health and the wellness of every person, food insecurity, the air they breathe, water they drink. KP's climate journey has a rich history as a pioneer within healthcare for environmental sustainability efforts. But in fact, in 2016, we pledged to become carbon neutral, and in 2020, we did it. We were the first healthcare system in the United States to achieve it. We achieved carbon neutral status by reducing emissions, like many of you perhaps, through the production and the purchase of renewable energy and compensating the rest through carbon offsets. We're not super thrilled about the carbon offsets piece because we feel like we need to be owning every component of it. But the journey for us didn't start in 2016. Actually, surprising for many of you may be that it actually started back in the 1950s for us, where we installed air pollution control equipment because we were serving the underserved in our very agricultural area. We had the first farmers market of any hospital in the country. We also did the construction of the first renewable hospital microgrid in the United States. But here's what we've learned along the way, is that return on investment in building a more sustainable healthcare system is not only the right thing to do, it is the mission of the organization. It's the right thing to do for health and well-being for the planet, but it also comes with financial rewards. In fact, when we achieved carbon neutrality, we improved our energy use efficiency by 7%, saving the organization $20 million annually. And when we decreased water intensity by 22%, we saved the organization $4 million annually. So again, I just encourage, especially the chief financial officers that might be in the room, is that if you're not finding the savings through doing sustainable work, you're not being creative enough. I'll share with you two specific examples. Advanced HVAC technology, through our project in particular, reduced natural gas utilization in our hospitals. And this is an interesting one that's not cost prohibitive. Ventilation rates in hospitals are higher than in most normal business buildings, resulting in high energy consumption. Hospital designers, operators, and code officials generally assume that higher rates of ventilation actually do a better job protecting patients and staff and other occupants from infection, many disease organisms which may present in a hospital at any given time. However, there is very little available information that justifies the specific ventilation rates that are built into our hospital codes across the country. This project measured airborne contaminant levels in several different spaces within an operating hospital and varying airflow rates to determine the relationship between the ventilation rates and the contamination levels. The intent was to propose that active indoor air quality measurements directly control ventilation rates. However, our research demonstrated varying the ventilation rates above 2 air changes. I know this gets into a lot of detail, but anything above 2 air changes per hour has minimal effect on the contaminant levels such as carbon dioxide and particulates. So the study concluded code-required ventilation rates that we have across the country are much higher than necessary for contaminant control and can be significantly reduced without adverse impacts on patients, visitors, and staff. And the results were impressive for us. Reducing ventilation rates in the studied hospitals saved over 95,000 therms, or 21% of natural gas, and 2.8 million kilowatts, or 25% of electricity. Carbon emissions reduced by more than 2,480 metric tons of CO2. Replicating this project in all of the hospitals just in the state of California could save more than 26 million therms of natural gas, 760 million kilowatts of electricity, and could additionally reduce carbon emissions by more than 670,000 metric tons of CO2 annually. And again, in this case, like in many cases, the conversion may be accomplished in controls of a software system. So the cost of implementation essentially is nothing. And in fact, the financial savings just to Kaiser Permanente in 1 year alone was $40 million. Implementing the change across California will require all of us to educate our staff that we need to actually use evidence-based ventilation methodology. We use evidence-based medical experience all the time. Why not use the evidence-based application for sustaining the environment? Kaiser Permanente San Marcos Medical Center opened a year ago, in 2023, and is a nationally recognized facility for its environmental stewardship. The new hospital earned LEED Platinum certification from the U.S. Green Building Council, and this makes San Marcos Medical Center the only 3rd hospital in the state of California to achieve platinum status. We need a few more to come along. Additionally, San Marcos is one of 65 LEED certified facilities within Kaiser Permanente. Kaiser Permanente has LEED certified facilities, more LEED certified facilities than any other healthcare system in the world. San Marcos sustainability highlights just a few things, and we heard a little bit about building earlier. The building has a microgrid, which generates most of its electricity, and is also the first line of defense in any event of a power outage, which does have a tendency to happen in the state of California. San Marcos is 25% more energy efficient than older hospitals, And we also use native plants and efficient drip irrigation that has saved 400,000 gallons of water per month, which for us in California, water is precious. That is essentially the equivalency of using 1,000 homes supplying their water for an entire month. And that's just something we did at one medical center. We also use flooring, insulation, and furniture made of low-emitting materials to improve air quality, and no, it doesn't have to be more expensive furniture. The total savings of just these measures alone saved one hospital $500,000 a year. So here's my key takeaway. Although the healthcare sector should be taking the lead in addressing climate change, it's part of the problem. Our mission is total health, and doctors swear an oath to do no harm. And yet, unfortunately, that's what we are doing, and it's not right. Healthcare operations contribute significantly to climate change, and as a result, we are actually truly perpetuating the very diseases we are trying to fight every day within the organization. Action on climate change is not a nice to have, it's a must. And the number two thing, if I remembered yesterday, that's causing consternation with CEOs in the United States, the number two issue is around financial challenges. This is a way to tackle your financial challenges while at the same time is doing what's right within the organization for the communities that we're privileged to serve. Thank you very much.
Thank you so much, Carrie. And these are women not only with great minds, but with financial muscle as well. And the famous management guru, Peter Drucker, says, what gets measured gets done. What gets measured gets done. And I think thank you so much, Zenith, for sharing those wonderful, returns on investments, KP's journey in leading, cost and savings. So a quick question for you, Carrie, and Zenith can follow it up, is that, what advice can you give our audience when it comes to convincing your boards, your teams, to prioritize funding for net zero initiatives?
Well, luckily, is this on? Can you hear me? Luckily at Kaiser Permanente, we don't have to give advice to the board because the board has actually required the health system to prioritize this. So my one recommendation for the CEOs out there is this should be something that's important to you. So as you're going through the board nomination process, look for board members that are actually focused on the communities that you're privileged to serve and who may have a passion in this space, because then when you have a passionate board member, it will translate to the rest of the organization. And actually, what we've done is actually put goals out there for the organization from a leadership perspective, essentially all the way down the line to make it something that's critical and important for the organization. So if it's a goal for the board, it's a goal for executive leadership, and then it'll be gold for the frontline staff as well.
Thanks so much for that, Carrie. One goal and everyone aligns towards it. Zenith, would you like to add something on that?
In my system, we have multiple countries, meaning multiple boards. So the challenge is very real. I think as accountability from our side as management, educating board members about this challenge, using appropriate tools, and as we know that our Geneva Sustainability Center has tools where the board and the management can play with it to see the impact and look at the ROIs as well. It's been a journey. It's not been easy. We have very pro board members, and there are some skeptical as well. But it's a journey. We take it, data talks.
Right.
And that, I think, is what my suggestion would be. Talk to them individually, as a team, and show them the impact.
Absolutely, and I think the game starts now. Collect every data that you can, because there's something we call data-driven decision-making, and I think those were wonderful ideas and figures that were shared by the two lovely ladies, Carrie and Zenith. We'll be now moving on to our final speaker for this morning, and we're going to be talking about sustainability beyond buildings and energy. Sustainability is also about models of care and engaging clinicians as fundamental leaders on this journey. To talk about this topic, we will be calling upon Nick Watts. And Professor Nick Watts is the director of the Center for Sustainable Medicine, National University of Singapore. Prior to this, he was the Chief Sustainability Officer of the NHS in the United Kingdom, where he led the efforts towards their ambition to become the first net zero health system in the world. He also worked as the executive director of the Lancet Commission and later the Lancet Countdown on Health and Climate Change. So Nick, over to you.
How is everyone doing? Yeah? Awake yet? It's dangerous to give someone like me a microphone this loud. You can ignore all of that nonsense about the NHS and about Singapore. There's really only one thing that matters about my CV. Where is my accent from? Did someone just say New Zealand? Absolutely not. I'm Australian, hey? Never give an Australian a microphone like this. I'm going to be quick, because let's have some discussion. I'm going to talk a little bit about some of the myths that you bump into, and they are myths that you bump into when you work as a clinician, as a doctor, inside a healthcare system directly tackling climate change. I think there are three things that we hear. I think number one, you hear, I would do this, but it's going to be in tension with good clinical care. Number two, you hear, I would do this, but it's going to distract me. I've already got 5 things I need to focus on. And number three, I think you hear, we would do this, but our doctors, our nurses, our physiotherapists, our health professionals, they are tired. They don't want to do this. All of that stuff is utter nonsense. I'm going to talk about 3 quick stories, hey, to work through that. Number one, when you think about detracting, when you think about that tension, there's a guy, Cliff, somewhere up in the north of the United Kingdom. He's a surgeon, orthopedics. He looked at the packaging that they had there and said, this is ridiculous. We have 6 instruments here. I only need one of them. I take one of them out. I throw the rest of them away. It is wasting money. I get told to save money all the time. He goes to Medtronic and to Stryker and says, can we change this? And they say, absolutely we can. This is clearly ridiculous. But there's an infection prevention control problem here. And he thinks about that and he goes, well, I'm not really sure that makes sense. So he goes and speaks to his colleague in IPC. And they say, no, I can't really think of that either. And what you start to get is sensible clinicians interrogating a myth. And they take that to the chief nurse of the hospital and they say, well, no, I think this is probably pretty sensible, but I know that NHS England, I know that at the national level, they don't like this. So we went and spoke to the chief nurse of the national healthcare system, and she said, no, I've never said anything like that, but I think the Care Quality Commission has a problem with this issue. So we go, okay, fine, and we find Ian, the chief executive, and we say, well, Ian, we've been told by everyone that you're the problem, you're the blocker, and he says, I've never said anything about this ever. This is ridiculous. Clearly, we don't need to throw out 5 of the 6 instruments that we're purchasing while only using 1. But I do know that June has a big problem with this. She works for MHRA, the medicines regulator in the United Kingdom. And so we roll our eyes, and now we have Cliff, and we have the chief nurse and an infection prevention control nurse, and we have the chief nurse of the country, and we have the chief executive of the Care Quality Commission, and we go and speak to June, and we say, this is ridiculous. Why are you blocking this? And she says, I'm not. I don't know what you're talking about. There are these myths out there that there is a tension, and too often they are not interrogated. First in one hospital, then in an entire integrated care system, Medtronic and Stryker changing the way that they are packaging that almost overnight, the second you dispel that myth, the second you actually clinically interrogate it. The second thing you hear is that I've got too many priorities, it distracts. There's a community nurse, Louise, up in the North Midlands. She's pretty cool. She cares about two things. She cares about pneumonia in the elderly, and she cares about sustainability. Hold on to that for a second, hey? She looked at her hospital and said, we're spending a lot of money on energy at the moment. Couldn't we do what some of the clever people to my left have done and put a couple of solar panels up? I know it's cold in England. I know that it is rainy. I know that it almost never there's never any sun, but couldn't we save a little bit of money? She did the modeling. The answer was, yeah, you could supply about 45, 50% of the energy demand of a hospital if you really went for it. So she went to her chief financial officer and said, this makes good sense. Can we do it? And he says, no, I'm so sorry, we just don't, we're very capital constrained, we don't have the budgets. And she goes, okay. And then she comes back 3 months later and she says, what if I went and crowdfunded £300,000 from the community, set up a community trust, and then used that money as the capital outlay? And he said, well, I don't think we're allowed to do that. There's some pretty serious regulations that would stop us. And Louise said, oh dear, I've already done it. That hospital now gets 50%, 55%, 60% in the summer of its energy from its solar panels on its roof and on its brownfield sites. That's really cool. What's even cooler is that Louise had two passions. She cared about sustainability and she cared about pneumonia in the elderly. The savings they make from this, they put back into community programs, into tackling directly fuel poverty in the elderly across the community. They've seen a 6% reduction in the number of people that show up with pneumonia over winter. 6% is not nothing, hey? The third myth you hear around this is that, frankly, clinicians are not that interested. My last story is about a micro-grant scheme that we ran in the United Kingdom. If you had a cool idea, we had £5,000, £10,000, just a little bit of money. The criteria were pretty simple, actually. All you had to do was demonstrate that you were directly tackling climate change, directly improving the health of your patients, and you had to have fun. We wanted to see a smile on people's faces because it is the team that is having fun that I'm going to put my money on winning anytime, hey? It was 2022, 2021, 2022, bit of a rough year for clinicians, for health systems everywhere in the world. We were thinking we would do really well if we had 50 applications, 60 applications across the country. Maybe we would double that next year. So we put out the terribly named Healthy Futures Action Fund. And by 2 p.m. on Tuesday, within 36 hours, we had to close the whole thing down because we didn't get 60, and we didn't get 100, and we didn't get 600. We got 7,000 applications because we had forgotten that when you give clinicians the opportunity to take control of the future of medicine, they will grab it from you with both hands and they will run. Our chief financial officer came to us and said, Nick, I'm not normally a big fan of these micro-grant schemes. You can't always demonstrate impact. But my partner is a GP, and they've had a really bad 2020, 2021, and 2022. And for the very first time ever, in the last 3 years, every single member of their practice, all the nurses, all of the support staff, all of the clinicians, all the doctors, were at our kitchen table talking about all of the different things that they wanted to do to improve the health of their community and take advantage of this fund. I've never seen their eyes light up like this. I have a question. Can they apply for 2 grants? Is that okay? We've heard about a whole bunch of myths over the last 30, 40 minutes. We've heard about a myth that you can't get going unless you have enough data to get going. Nonsense. We've heard that this costs too much. We know that you can act on the vast majority of your emissions profile without significant additional capital outlay. We know that where there are capital pressures, the return on investment is better than almost anything else. And we know that when you poll healthcare professionals in the United Kingdom, 92%, in Singapore, 88%, in France, 89%, in Australia, 90% of them want to run at this problem. They want to work for a healthcare system that lives up to their own values. Data, cost, and clinician engagement are the 3 myths you hear the most, I think. I think there's a 4th one. Okay, fine, I believe you, we should run at this. I believe you, it's not going to cost too much, but it's just too complex, it's just too big, this is too hard. That's the worst myth of them all, because those who say that it can't be done should get out of the way of people that are already doing it. We are seeing in the United Kingdom emissions reductions of 57% against its 1990 baseline, already running well ahead of the Climate Change Act. It's time that we stop inventing reasons that we can't act and get on with it at 9 a.m. tomorrow morning. Thanks, guys.
Thank you. Thank you so much, Nick, and putting in that heavy accent. I'm sure you added plenty of humor. And indeed, these myths are something that we are always tackling with. So Nick, you have extensive experience globally in this field, and you've shared some wonderful stories with our audience this morning. Do you see any evolution or trends worldwide about the health sector's engagement when it comes to addressing climate change? Do you see it accelerating?
I was joking about not giving me a microphone. I think there have been three major periods in this field. I think in the 1990s and in the early 2000s, we had a couple of passionate individuals who were working on this saying, God, this stuff really matters. But frankly, not many people were listening. They were in the campaigning phase of this transition. I think in the 2010s, things started to shift, and we started to see royal medical colleges, royal nursing colleges, we started to see major medical journals starting to engage with this. That mainstreaming process, I think, took us about a decade. And I reckon around 2019, 2020, I'm looking at Sonia to see if she thinks I've got my timing right, we left that campaigning phase, that mainstreaming phase, and we entered the implementation phase. One of the questions I have frankly never been asked since I started working on this in the United Kingdom or in Singapore is, should we do this? Mm-hmm. The only question I have ever been asked by serious professionals is, how do we do it and how fast can we go?
Right, thank you so much, Nick, for that. Once again, a reminder to the audience, please log into the Congress app, go to Plenary Session 2, click on the Q&A tab, and please share your questions with us. We will also be having a very interactive session towards the end of our Q&A, so please keep your phones handy. We've received some wonderful questions to Zenith, and a very interesting one on leadership competency, Zenith. How can we make sustainability a leadership competency and expectations of success in leadership in healthcare?
Thank you, Toseef. Great question. In my own experience, as I mentioned, 10 years back, we started this journey in our institution, and we all needed to understand it. We needed to learn about it. We needed to, and Nick actually talked about it. I mean, it's not that individuals don't want to do it. We just are too busy, and all those myths he talked about. I really think that it's not that difficult. In my own organization, just talking to people in East Africa, somewhere where clinicians are really overburdened when a clinician has to see 500 patients and so on and so forth. But when you talk to them, cup of tea, just chatting with them, they know more and more about it. The competencies, there are very good programs out there, guys. Look at it, look at them, be scientific, learn more about it. Only babbling doesn't change. We need to go to the experts, and there are experts there. So in my own organization, we had done workshops for clinicians separately, for middle managers separately. We needed them to come together at different levels, and we did that. Lots of resources, including with Sonia's department, I mean, the Center of Sustainability and many others. Science is important, but with that, art is important. Let's have hearts and brains together to bring the teams together. And I think we have been successful in AKDN by doing that.
Absolutely, absolutely, Zenith. And I think what conversations that we've been having from yesterday's plenary session and today is how to build the human touch, how to build compassion in our leadership journey when it comes to going green or listening to, you know, your teams. I think there's that aspect of having that one-to-one collaboration, and that's a wonderful perspective, Zenith. We'll now move on to Vital. As you know, Vital comes in with very extensive architectural experience. And the question for you, Vital, is how can we make design of future hospitals to have on better environmental impact? So what the question is really around is that how can we design the hospital to have a better environmental impact?
Great question. I think the infrastructure is central in this aspect. We talked a lot about convincing people, creating the culture of sustainability. But somehow the infrastructure is the anchor of everything. We can't change it fast. So maybe we could say that there is a myth about the super efficient building. They put a lot of attention on this and they don't care about what's happening now in your building and how to get there. So it's very hard to have the opportunity to build a new block on your hospital. And yes, there is a lot of opportunity for, there is an example, the Sírio-Libanês hospital in São Paulo that doubled the capacity. And basically they reduce the consumption of energy and the emissions. But I would like to emphasize an aspect that's very important and I didn't explore enough in my presentation, which is have more accuracy on the data. For example, we used to measure I saved 1,000 kilowatts or I saved 10 tons of carbon emissions. But what does it mean in your operation? It could be very small, but it's an impressive number. And we are working with relative indicators, means that based on production or based on infrastructure, the production is patient per day or any procedure. Infrastructure is square meter, and also the the number of employees. So using this, you can say if the new building or the new process or the change that you propose really bring the result. And so there is a lot of technology that could be explored. And I think we should be very open for all this. As Nick said, maybe if you don't have sun, and even in a place like England, the solar panels works. So there are myths again.
Thanks, Vital. And you bring in again a very important point on how to incorporate technology. And I think we've had some fantastic sessions yesterday on using AI for making decisions and building processes. So thanks, Vital, for bringing that perspective. Nick, a quick question for you before we get into the next segment of our plenary session. Can you talk more about the micro grants and what the results were? Was there team engagement sustained from the efforts, and were there sustainability challenges that you encountered? Okay.
Thank you. It's probably worth thinking about what that microgrant scheme really is. It is not a mitigation intervention. Sure, maybe it will have some mitigation interventions. It might reduce carbon a little bit, but primarily when we thought about it as a way of engaging with our 1.4 million staff. We thought about it as a way of starting to get people to have a conversation in their community, in their practice, in their ward, and start to think about it. We didn't massively care if they got it wrong, to be honest. As long as you went and learned something, as long as you enjoyed yourself, as long as you sort of started tomorrow morning and kept going the day after. The sorts of things we got out of it, pretty wild and diverse. We had drones delivering rare chemotherapy, cisplatin medications down to remote hospitals. Normally it would take a truck, a hovercraft, and another truck to get to the Isle of Wight. Instead, a drone gets there in something like 10% of the time, half the cost and almost no carbon. We had a physiotherapist who works in a stroke ward up in Birmingham. One thing we know about stroke when you're recovering is that proprioception, that's sort of sense of, that sixth sense that you have in your muscles and joints, really, really important. And you can train that by having people walk and act and have to learn to live on uneven surfaces. This guy loved gardening, so he went and set up a community garden within the hospital, used the garden as a rehab center for his patients, and then for the mental health patients as well, started to use it to manage sort of garden and active therapy. We had really basic and boring examples of someone that said, I think that if I had an electric vehicle, I could save a little bit of money for my rapid response system. I think if I had an electric bike, I could get across. If anyone's been to Oxford, it's a lovely city. Never try and drive a car through it in the middle of the day, in rush hour. You can't get across in less than 3 hours. But if you have an electric bike, you can get through in about 10 minutes. Really, really simple ideas. What you're sort of hearing is that no one is reinventing the wheel. No one's doing anything wild and really out there, but they are all enjoying themselves and all learning something.
Right. Thanks so much, Nick. Thank you so much for such wonderful questions. Unfortunately, we may not be able to tackle each one of them, but do keep them coming. You can access the profiles of the speakers from our Congress app, and I'm sure they will be available, and you can ask them more questions. So as we go on to the next segment, I'm just quickly ask, the last key messages from the speakers. So we'll quickly start with Zinat. Anything that you'd like to add, just as a quick key message for our lovely audience to take home with? I think
It's working.
Yeah, okay, all right.
Thank you, Toseef. I think my message is we can do it. It doesn't matter which geography we are in. If this is the priority, if we make that as a priority for us in our organizations, through strategic planning to operational planning, involving the staff, working together, we can do it. It is a problem. It is our problem, and we cannot close our eyes.
Absolutely, absolutely. We can do it. That's really the message coming in very loud and clear from Zinat. Vital, what are your thoughts? Any key takeaway that you'd like our audience to?
I couldn't agree more with Azina, and I want to say that we never have before that much willing, that much intelligence, that much capacity to face the climate change. I see a huge challenge, but again, we can do it, and we have this possibility, and we are getting much more organized on this. There is much more cooperation. There is a scenario that could, we can expect more funding for this because it's very important. It's healthcare. We need money to do that. So I hope COP30 brings some incentives for the health systems to get there.
Wonderful, wonderful. And Vital really talks about incentives again, and another brilliant point there, Vital. Carrie, your thoughts?
I would say get involved. Join the Geneva Sustainability Center. Continue to come to IHF. Any problem that you have within your organization or a myth you might be facing within the organization, somebody else has solved it, likely within the world. So stay connected.
Fantastic. Sharing success stories. Thanks, Carrie, for that. Nick?
I think I now have all of the microphones. You get asked a lot in this space, hey, what's the biggest thing I could do? What's the one single biggest thing I should do if I really care about this and want to run at the problem? And the answer, I think, is pretty damn basic. Do whatever the hell you're actually going to do. It doesn't matter. It doesn't have to be the biggest thing. It doesn't have to be the most important thing. It doesn't have to be the thing with the biggest return on investment. You have to do something at 9 a.m. tomorrow morning, and then you do it again the next day, and then the day after that, and slowly you build up a team, and slowly you build up friends and momentum, and over time, you start to take on those big things. I think we paralyze ourselves too much by saying this is too complex, there's too much expertise, it costs too much. Starting at 9 a.m. tomorrow morning, I think, is the only thing that matters.
So the power of habit. Really starting small and being consistent about your results. Thank you so much, Nick, for that. And as we wind up, I think we've had so many takeaways from this morning's session. And environmental sustainability really is a core component of health delivery, and addressing climate change is part of our mission. As we've seen today, data can be an ally, and there are tools available to support you on your journey, including those that Carrie mentioned from IHF and the Geneva Sustainability Center. Cost is not a barrier, nor is it an excuse. We have seen two examples from Carrie and from Zenith that can be taken and implemented and measure your return on investments. Hospitals must address sustainability at every level of the healthcare delivery, and this involved engaging employees across the hospital, including clinical staff, as Nick mentioned. Sustainability is not just about buildings, it's also about health and the service that we deliver. It's a fantastic partnership with IHF this morning and the Geneva Sustainability Center. And ladies and gentlemen, they're here to support healthcare leaders on this journey. I encourage you to visit their booth to find out more about the work and how it can help you. One of the latest developments is the new Healthcare Sustainability Certification in partnership with Joint Commission International, which has launched 2 days ago to recognize the champions globally. Before closing, I'd really like you to take your phone and please log into the Congress app, go on to word cloud, and really give me some quick key takeaways that you have learned from this session. Please open your phones, go to the Congress app, Plenary Session 2, you'll see a tab, Word Cloud. Please keep tapping. Thank you very much, our esteemed speakers. Thank you, audience, for being here this morning. Thank you for being so interactive and your questions. Once again, thanks to IHF and the Geneva Sustainability Center for having this great session, and I wish you great deliberations as you proceed through the day. Thank you so much.